Good morning, everyone, and welcome back to day 2 of this wonderful conference. I had the distinct pleasure of being here last year, and I think word gets out this is truly on the path of becoming international, and I really appreciate everybody's involvement in really dealing with this issue of reducing violence and being able to work together, come up with ideas, share ideas, and network. And I think that if it's anything like last year, the work just begins after the adjournment of today's conference. And I'm here really to give a few words about what we are committed to do at St. Francis Medical Center, but to also share with you the things that can be possible in the future. You know, all of us are a piece of this puzzle that really has so many dimensions, and each of us really is no stronger than the other, and that collectively we come together with really a shared vision that's to reduce violence and violence-related injuries. And we all have the shared theme of really being able to demonstrate success through the endeavors of our own organization. But if you imagine us coming together and working collaboratively, what we think we can do in the future. Last night, I think, is evidence as to what happened in Cleveland as to never losing hope. You know, it was a miracle as to what happened. You had families, friends, and the public that were never going to be, I guess, accepting the end. And it was just really brought to mind how we can really collectively look at something and give that enough energy and hope and resolve, and we can make things happen. I'm here today because I represent our tremendous team at St. Francis Medical Center. We're very proud of our trauma program, and many of you may be a part of a trauma center. And many of us are known to be having stellar clinical protocols, great outcomes. But I think what makes the trauma system for LA County and St. Francis so distinctive is we have leadership like Dr. Shepard and Paul and the entire trauma team that inspires everyone at the medical center in our community to go beyond the walls of St. Francis and to be assured that our responsibility doesn't end with just providing critical life-saving medical treatment, but to also build that continuum to break this vicious cycle of violence in our community. And I wanted to share with you just a few statistics. You know, every CEO has to really give statistics, and bear with me, but I think they're very, very, I think they're very dynamic if you want to hear some of these statistics that come from LA County and the public health homicide that says that the second leading cause of premature death in Los Angeles, topped only by coronary heart disease, is that homicide, and that there was 723 deaths in 2009. And to put it in another perspective, these 723 deaths represent over 30,000 years of life lost. Now that's a statistic, and I want you to remember that because I'm going to come back to that later in my call to action. Because this means that men and women who did not live to see the expected age of 75 or all of life's indelible experiences were lost. Over 30,000 years of life lost. And I can tell you that in 1993, when we became designated as a trauma center for Los Angeles County, we were really responding to an unmet need of our community. We live in an area that's referred to as Southeast Los Angeles. When you start looking at the city of Linwood, We, back in 2009, had 228 violent crimes committed either through homicide, rape, assault, or robbery, which equate to about 145 crimes per 10,000 people. Our service area also includes Compton, and Compton actually has 198, almost 200 crimes per 10,000 people. So it really is our responsibility to meet this unmet need of the community. As with many medical centers, we look to see how do we respond to the community need, and really an earth-shattering result of our community needs assessment in the early 90s is, what are your top health concerns of the community? And we canvassed the community, and we said, okay, in rank order, what would they be? Our expectation would be living healthier lifestyles, smoking cessation, cardiac disease, but we were surprised that what everybody wanted was education, housing, transportation. And as we started to talk to the youth in our community, I asked the question, why weren't these other things ahead of what you had said? And some of the youth in our community said, I'm only hoping to survive this summer. So I don't think beyond the window of this summer in years ahead. And this really was a compelling reason for us to really say there's a call to action. And luckily for us, we started our trauma program back in 1991. As you know, the impact of violence is far-reaching, and the pain and anguish of the patient, the heartache of the family and loved ones, and lost hours of work, school, and home is really tragic, and the unqualified loss of human potential and unrealized dreams. You know, all of us in this room, as I said, are here for a purpose. And we have our founder, St. Vincent de Paul, that really guides us as to how we want to look at care and look at initiatives. And we thought this quote really represents everybody in this room. And he says, "You will continue to succeed in your leadership, in your duties, because our Lord's work is accomplished, not so much by the multitude of workers, as by the fidelity of the small number who he calls." Think about that. In today's room here, we've all been called. We have been called to be the leaders of change. We are the healthcare workers, social workers, teachers, counselors, lawmakers, policymakers, parents, students, and community members who can ignite the movement to end youth and gang violence. We each bring specialized knowledge, skills, experience, expertise, and understanding to the table, and together we can create a collaborative team equipped to influence a new perspective. It's a vision of what life should be and what their life can be when we take violence out of the equation. So today, I want to acknowledge all of you for the work you have accomplished and recognize some of the dynamic collaborative programs we have had the opportunity to establish with you. These programs are successfully reaching the youth of our schools and neighborhoods and are empowering the young men and women in our community to build for themselves and their children a future without violence. You know, I wanted to thank the Violence Prevention Coalition of Greater Los Angeles for their partnership and sponsorship in creating events like today, and for the partnership that we have at St. Francis Medical Center. And as Paul mentioned, I have the distinct honor of being the chairperson of the LA Trauma Private Hospitals. And when we start talking about the Violence Prevention Coalition and Haven, which I think was really as a result of really the resolve and commitment of individuals in this room, Haven standing for Hospitals Against Violence and Empowering Neighborhoods, I really want to have a call to action with my colleagues that make up Haven. And those hospitals consist of UCLA Harbor, it consists of Rancho Los Amigos, St. Mary Long Beach Memorial, California Medical Center, White Memorial, and Kaiser in Panorama City. Because as hospitals, we always look at initiatives that really are affecting public health, much like curbing obesity or curbing smoking or really having an impact in heart disease. And many of you that are part of hospitals are very familiar with the Institute for Healthcare Improvement and the 100,000 Lives campaign, where we committed to use evidence-based medicine in order to save 100,000 lives. I'm really going to ask my colleagues that represent Haven and the other private hospitals that comprise the LA trauma system for Los Angeles County to really look at this as a public health issue and really to envision, much like IHI, how can we mobilize the appropriate resources so that we can measure years of life saved? I think, wouldn't that be a dynamic thing we could all embrace and be able to take that 30,000 lives lost and equate those into years of life saved? So I'm committed to really mobilize the resources that comprise the LA Trauma Private Hospitals, and hopefully at our third annual event, I could share with you the process and progress we've made in achieving that. I also wanted to thank and commend Paul with his Crossroads Wages program. We've had the fortunate bestowing of $200,000 for the next 2 years to really try to look at case management and do intervention that will really allow for individuals to live to their full human potential. And as Paul mentioned, we've been on this 15-year journey of being able to allow our residents in the communities we serve to live to their full human potential. Back in the early 90s, we started a program called Earn Respect. And after Earn Respect, we went into a program called Beyond the Streets. And I can tell you that all of you in this room measure success one person at a time. And we still keep track of some of those participants. We have 15 students that have either graduated into a higher, pursued a higher level of education or are gainfully employed at the medical center. We've got 3 graduates that are EMTs, 3 graduates that are in our engineering department. We also have someone that graduated and is now an LVN, actually working on our trauma floor, giving back to the community. And we also have a member that's in our CNA program as well. So I know that through programs like Wages, we'll be able to continue with being able to change this vicious cycle of violence and to be able to really make an impact in the near future. I also wanted to close by saying that as a hospital, many people see our role as treating the victims of violence or injury. However, to truly treat the whole person, body, mind, and spirit, as the Daughter of Charity mission calls us to do, our commitment is to be proactive in preventing violence and injury and assisting patients beyond their treatment in the hospital. That is what today is all about. We are very proud to be a part of this conference and then in the company of your organizations and agencies. We are the voice against violence, and in unison, our urgent message will be heard. We have opened a dialogue across public and private sectors, cultures, classes and ages and disciplines, and together we have the power to put odds back in our favor of the youth and men and women in our community for them to save lives, healthy, productive, and to really live to the full human potential. So I want to thank everybody for being here. But I also wanted to give a special shout out to Dr. Shepard. And Dr. Shepard will be convening one of the breakout sessions today, because it's really through his visionary leadership that inspires all of us at St. Francis to do more. And there was a compelling statement he made at one of our last trauma committee meetings. All of us are very proud, as we have a motto at St. Francis that says our mission is life. We deliver about 7,000 babies a year, and we make sure that everybody's life ends with dignity. And our mission of life really talks about our partnership with One Legacy. And we were sharing the statistics that we had in terms of organs for transplant and how we can continue to save lives in the future. And I think when we were presenting that information, everybody really gave a big hurrah and shout out for all the wonderful work we did. But Dr. Shepard had the lone voice, the courageous voice to say, all of you are missing the point. We can celebrate in that we have a wonderful relationship with One Legacy. But our collective goal as an organization and trauma center is to prevent those deaths from occurring. And it's really through the commitment and the collaboration that's going to occur this weekend that we could really be able to fulfill that dream and have less victims of violent crimes affect all of our lives. So thanks for everybody's participation. I look forward to hearing the outcomes of all of the wonderful work that's being done yesterday and today. And thank you for everything you do. Great.